So I'm really excited to talk about the clinical results from our first clinical trial in Kuala Lumpur, Malaysia with Dr. Harwant Singh at the Pantai Medical Center. This was a 5-patient, first-in-human trial, primarily a safety study, but we were also obviously looking at the effectiveness of this treatment. And we've had good results after fantastic results. And in fact, to some extent, our results are so good that people are finding them hard to believe. But we're not surprised, because this confirms what we've been seeing in the laboratory for 18 years and what we've seen in animal studies over this past almost 2 decades. The patients from 2 weeks from our first assessment point through a year are having dramatic reductions of pain and disability. In fact, all of the patients, all 5 of our patients at 3 months had excellent results, which means both pain and disability were decreased more than 50%. And 2 of the patients have no pain, no disability. And one of those patients, before the procedure, was shown to be clinically unstable. We subcontract with a company called Medical Metrics. They do kinematic analyses of our patients. And one of the first 4 patients was found to be clinically unstable prior to the procedure, 2.5 standard deviations above the norm. But immediately after the procedure, was found to have 0 instability in her joints, and also a complete elimination of pain and disability. So this goes to prove the connection between the mechanisms of our treatment that we've seen in the laboratory and the elimination of pain and disability. So this is really profound. This is the first time I've ever heard of an injectable treatment that's able to go to the source, the core pain, the source of the pain, and that we can document that we have eliminated that source of pain, the instability of a spinal joint, and have been able to correlate that with a complete elimination of pain and disability in one of our patients. So these results are, as I said, they're excellent results. Compared to what we've seen from other injectable types of treatments with epidural steroid injections, ESIs, you have a fairly high percentage of pain relief, but for a fairly short period of time. So even at the 3-6 month time point, when we are seeing a continuation of pain relief, we're doing better than ESIs. And at 1 year point, all 4 of the patients that have made it to the 1 year point post-procedure to date have excellent results. So this really bodes well for this treatment being a permanent treatment, as well as having a dramatic immediate effect. Our patients are doing well 2 weeks out, or even 2 days after the procedure, because the treatment is a fast-acting treatment. We've also found in the Medical Metrics kinematic data that all of the patients had an increase in lordosis. That means they're able to stand in a more normal posture than they would otherwise. People with low back pain tend to be a bit hunched, but consistently all of our patients had an increase, a dramatic increase, statistically significant increase in the lordosis of their lumbar spine. We also found that their range of motion was increased 10 degrees, flexion, extension, range of motion in these patients. And that confirms the pain reduction numbers that we're seeing. When somebody is experiencing less pain, then they're feeling more comfortable to flex and extend to a greater degree. And so we have these pain reduction numbers being correlated by kinematic data. We see a mechanism of pain being eliminated by this kinematic data, and a correlation with a complete removal of pain and disability in the one patient that had clinically unstable spinal joints. So, so the results to date are phenomenal. It's a safety study. We demonstrated no serious adverse events at the 1 and 3 month point, which was one of our key metrics in this study. And we're very excited to move now into a multi-site trial. We're looking to do clinical trials in Canada, in the US, and in Australia. We may find that we may have a higher percentage of people with a psychophysiological pain situation where our treatment, though it is effective at addressing the core problems of degenerative discs, may not solve everyone's pain issues. But to date, we're seeing that we are having the effects that we hope to have, and that we're making the difference in the clinic that we saw time and again in our experiments in the laboratory and in animals.